has been an area, it's called the Valley of Death. And any time that I talk to an entrepreneur in life sciences about the Valley of Death, they know exactly what I'm talking about. Because if you ask a venture capitalist, when do I get involved in they will say that they do early stage. You have to ask the next question, and at what year do you get involved in the early stage? And they will say typically year 3 or later. Why is that? What happens in the 0 to 3? In the 0 to 3, the only funding that has really been available in more recent years has been friends and family. And it can get pretty bad. If you've got friends and family that fund and you're a hot shot at, let's say, Stanford University, what do you typically do? Well, you're around in Silicon Valley with all these people making tons of money, and you think you've got the next greatest thing. You tend to put a valuation on that is far above what it should be. You could say, oh, I'm going to go out at $50 million with friends and family. Then 3 years later, you go to the venture capitalist and say, I've got a really great idea. And they say, you've got a really great idea, but it's a $10 million valuation. And I think that's really been part of it, and there's certainly many instances of that happening. People need some coaching early on through the 0 to 3. They need to get the right valuations and the right structure in all of this. They need a lot of things that they're not currently getting. And so this is an area that we've done a deeper dive on. We've, at the Stetson Family Office, looked at 33 cities around the globe and put together a readiness survey. And we believe that there are 8 cities around the globe, about half in the US, that can be the next, I'm calling it now Big Kendall Square or Little Kendall Square. There are places like St. Louis that clearly can be a Big Kendall Square. They've got all of the infrastructure to do that, and they could be really good. But there are other places that we're working with that can be Little Kendall Squares. They're not quite at the point of really having the deal flow pipeline, but they've got good infrastructure, they've got a desire to really do it, and it's a good place to start. And even in some places, like in, I'll just give you an example. In one state, we're starting with a smaller city. We'll bring in the other cities along the way, and I think that there can be, it's easier to start with a smaller city. There's one of the problems is that in some of the big cities, and you can kind of pick the names, so I won't mention any names, but you can imagine who they are. When you get big hospitals that are leaders in the field, they tend to not deal with you very well. I went to a foundation that I'm close to that funded a big section of this hospital that's very well known. And the name of the major donor is on the door. I was connected with the PR department. That's part of the problem. We've got to start pulling stuff together, and I'm really thrilled because we have a really good panel together on this. But let me make one more comment, and then I'll move a little bit to where the panel is. But I was just in Nashville last week. They style themselves as the healthcare capital of the world. And they had one guy that has an incubator. He's a family office. And they have about 60 companies in. And he said, I know my heart's in the right place. My wallet is really feeling the pinch. And so I said, well, how are you doing this? He's doing it on a for-profit basis. There's actually a reason why venture capitalists do not go into the 0 to 3 space. You can't make money on it. You need to de-risk things. If you come in at year 3 and it's de-risked, then you can make some money in the 0 to 3. So here, the philanthropic approach has not really been looked at. But let me tell you, there are plenty of dollars out there. Let me give you a little bit of information. If you look up the Giving Pledge, there are 180 signers about. I've looked at 156, and if you aggregate the dollars that they have said they would give away, it's $365 billion. Their average age is 66. You can do whatever math you want, but they have to give away a lot of money. Imagine if we could attract some of that capital to the life science healthcare space in the U.S. It would be incredible. So we have an incredible panel. I've been getting to know both the Bio New York and the Bio New Jersey efforts. And what I'd like to do is their membership organizations, they can speak for themselves. We also have the economic development departments in New York City and in New Jersey, and they can kind of lay out how they're looking at things. But I'm very excited. There's some very good things beginning to happen all over the place. When I started this effort 3 years ago, there's only, it was really St. Louis. St. Louis was, by the way, started by the McDonald family and the Danforth family. McDonald family sold McDonnell Douglas to Boeing, and the Danforth family sold Ralston Purina to Nestle. They decided to put some money into the Cortex area, which was 200 acres that the Washington University bought up. It was all factories that had been abandoned. That thing is so turned around. I was just out there last Tuesday at an office meeting that we brought people together on. They have 250 companies, 7 incubators now in that space, and they've now, through that incubator, funded $21 million into 75 companies, which has brought in $700 million into St. Louis. Companies that probably would never have come in, because what they have is they've set up essentially a venture capital entity within the nonprofit to screen things and de-risk the science, and to give the venture capitalists the due diligence. Venture capitalists generally don't share due diligence, but this is stuff that they're sharing. The guy who runs it is a friend, and he's had 14 years at Pfizer. He knows what the big pharma is going to buy and what they're not going to buy, because that was his job at Pfizer. And so they've had a good success. One company in St. Louis that they invested early on, they put $1.3 million for a third of the company. It was sold for $100 million. I'll do that deal any day. You know, you don't always get that kind of quick win, but what we have in the philanthropic model is a really interesting thing. If you think about the Wellcome Trust in England, when Sir Edmund Wellcome died in 1936, they had about 16 million pounds was his estate that he put in trust. It's now worth $25 billion. If you use that kind of model and you are giving out 5% a year into a philanthropic entity like the St. Louis needs to go to that. They're not there yet. They're doing everything right except for that. But I think that there's going to be some really great opportunity. So I've, in this introduction, thrown out a lot of different things, which the panelists, I'd like them to introduce themselves, and we can tell you a little bit about what they're doing, and then we can ask them to comment on some of the things that I've said. So why don't we start out with Debbie? Would you introduce yourself and what you're doing in New Jersey? And I think you have a governor that's pretty interested in this area. That's my understanding. That's what I'm hearing.
We do, and it's absolutely true. And Chuck, thank you so much for this. Thank you for this opportunity. Really appreciate it. And the work that you're doing is just incredible. It's just so exciting. And it's, you know, as Chuck started off, in terms of the Valley of Death, so important. So we're thrilled to be part of this conversation. So Debbie Moore, President and CEO of BioNJ, we're the Trade Association for Life Sciences in New Jersey. And did you want to do introductions first, Chuck? Or you
well, I just everyone self-introduce,
okay.
and like we talked about last week, if you could just introduce yourself and how are you thinking about what has to go on in New Jersey, and can just talk about some of the assets. You got a lot of good assets in New Jersey, and you've got a very favorable legislative climate with the governor wanting to be behind it. And there are some other governors that are trying to get behind these things. So I can see this getting a little bit competitive in the future, but you're early on, and this governor wants to do stuff.
Absolutely. Okay, thank you for that setup. So then what we had planned is, so I'll spend a couple of minutes sort of giving the lay of the land in New Jersey and sharing some of the reasons that we are so excited, as Chuck just alluded to. And then my friends from New Jersey, so Judith Sheft will talk about the academic institutions, how they're collaborating in ways that previously really unprecedented. And then Kathleen Coviello from the Economic Development Authority, who's talking about the programs that the state of New Jersey has. By ONJ, we want to make sure that New Jersey is a robust life sciences ecosystem. So this speaks directly to our mission. And so in New Jersey, we like to think of New Jersey as, an expert in drug development and commercialization. And we have, lots of evidence of that, including, the pharmaceutical industry there in a really big way. We have the whole ecosystem. So we have hospitals and medical schools, universities. The state's population density makes it a great place to do clinical trials, and we have plenty of them going on there. World-renowned research institutions, academic institutions, Rutgers, Princeton, NJIT, we'll hear from Judith in a moment, and Rowan University, Stevens Institute of Technology, and others. So New Jersey has about 3,300 life sciences establishments. 3 just came to New Jersey last week. We're thrilled to celebrate some ribbon cuttings along the way. We are headquarters or a major presence of 40 of the largest biopharma companies. We have a history of innovation and entrepreneurship that goes way back. Some of the more recent successes are pretty exciting. So Celgene, obviously, not so recent anymore, but doing really innovative things that are supporting the ecosystem, such as opening their own incubator within the last year. Amicus Therapeutics just got its own FDA approval, first ever. PTC Therapeutics on its way to, actually 2 approvals, one here, one in Europe. NPS Pharmaceuticals was acquired by Shire for $6.2 billion. GeneWiz, just about a month ago or so, was acquired for $500 million, a New Jersey homegrown story as well. And then Stellator and Permaset are also New Jersey stories. So we have an ongoing cycle of developing entrepreneurs and success, and then success begets success. There are more than 1,000 drugs in development in New Jersey today. In 2017 alone, companies with a footprint in New Jersey represented nearly 50% of all new FDA drug approvals, including the first 2 CAR-T approvals and the first FDA approval for digital medicine. There are more than 350,000 jobs supported in New Jersey, and the industry is contributing in excess of $100 billion per year to the economy, representing 7% of the state's GDP, which is twice the national average. So there are about 63 academic institutions turning out about 22,000 life sciences graduates each year. We have, in the earlier stage space, we have a growing number of incubators. I mentioned Celgene. Princeton University just opened a biolabs facility that is almost full in 6 months or less. So there's really an opportunity, given some of the things that are going on and have traditionally gone on with government, but there are just new programs being created all the time. Kathleen will talk about that. But in fact, our governor came in February, talks about innovation, life sciences at every turn. For the first time ever, we have an economic strategic plan in New Jersey that talks about technology and life sciences throughout and ways to bring funding, seed and other capital to the state. And then specifically things that have happened in recent years. The Rutgers-UMD&J merger has created, there are so many more startups coming out of Rutgers than ever before. Hackensack Meridian School of Medicine was just opened in July. They also have an incubator and a fund of their own. The Institute for Life Sciences Entrepreneurship at Kane University is starting companies as well. I mentioned Princeton and Celgene's incubators. As Kathleen, I'm sure, will talk about some of the space that the EDA has developed over the years, and our innovation hub that the governor proudly announced earlier this year. So one of the most exciting things that came out of the governor's economic strategic plan that he just announced about a month or so ago was a $500 million evergreen co-investment venture fund that Kathleen will, I know, be able to talk about. She's an expert. Some of the ideas may have been hers. And also, I chaired recently, just to give you more on the sort of the warm environment in terms of legislation in the legislature and the governor. So I chaired a biotechnology task force that was bicameral, bipartisan, and in about a 6-month period, we had obviously legislators on it who we came up with a whole litany of ideas and turned them over then to the legislature and the governor. And many of those ideas have already become legislation. Some have already made their way to the governor's desk and been signed, including the reestablishment of the New Jersey Commission on Science, Innovation, and Technology. So we're obviously very excited about what's going on in New Jersey, and just even more excited for the future. So thank you so much for your time, and I'll hand it over to my New Jersey friends.
Let me just make a comment. It's really more of a full disclosure comment. We do a readiness assessment, and we look at the 35 cities around the globe. There's just some that we know aren't going to make it, so we do bother with that. But we're very excited about New Jersey. Our process is we do a questionnaire first, where we go through a lot of the things that you put out as the key assets you have. It also tells us, where there's something missing. There's not a lot missing that I can pretty much say. And then we look and go and really want to understand the ecosystem. And then we are as a resource to getting an endowment type of thing raised, so you can have a sustainable, evergreen way of processing. Because the other thing that an endowment does is it says we're in it for the longer term. It really sends the message, and you cannot attract, I believe, the executives that you need to run the organizations, these smaller organizations, unless you have that ecosystem in place. Even if you have some really good big pharma there, that's always good for the exit, but you need some really competent people that really know what they're doing at the early end of things. And I think that we can work with New Jersey and even improve on all the good stuff that Debbie's doing, and we're looking forward to doing it.
Great, thanks. So I'm going to talk a little bit about the academic support that's available to really help early stage companies get through that valley of death and really help entrepreneurs, whether they're coming out of our academic institutions, and I see one of my colleagues from Stevens Institute of Technology is here as well, to be able to talk about whether it's an entrepreneur who's coming from an academic perspective, who's developed something that they're trying to move along the pathway, or whether it's an entrepreneur outside of the academic institutions, how we can leverage resources and capabilities that we have at all of our academic institutions to help that technology get to a place where it's going to be something that a venture capitalist would be interested in investing with. So at one level, all of our academic institutions, and Debbie talked about some of the numbers, we're training students at all levels in the life sciences. So many of the reasons companies want to come to New Jersey is because they're going to be able to get access to that talent, whether it's talent coming out of our community colleges, our four-year programs, our graduate programs. We've got trained people who are ready and able to get into those life sciences companies to serve as technicians, to serve as clinicians, to do research activity, but also on the business side, to be able to help understand and move the products forward. And I think, Debbie, some of the conversations we've had with companies who are thinking about going to Kendall Square, part of the reason they liked New Jersey was because of the talent that we have that we're able to bring from our academic institutions to support. Additionally, all of our academic institutions have early stage, we've got research labs where we've got equipment that, again, early stage companies are going to be able to get access to. So if you're an early stage or a virtual biotech company, you don't necessarily have to create your own full lab to be able to move your technology forward. Yes, we've got incubators, NJIT has one, Debbie mentioned some of the facilities. Kathleen will talk about the EDA's wonderful facilities, but sometimes you don't really even need a whole facility to get started with. You're going to be able to partner with our academic institutions on sponsored research agreements or SBIR or STTR agreements and get use of some of these highly expensive pieces of equipment on just the amount of time you need to do the work that you need to go forward. All of the New Jersey, many of the New Jersey research institutions have actually now also banded together to form the New Jersey Academic Drug Development Consortium. Rutgers University kind of took the lead in pulling a number of the universities together, NJIT, Princeton, Stevens, Rowan, to be able to cut across all of the institutions who are doing work in the drug development space. We've got a conference coming up on November 15th. If anyone's interested, we can give you some information about coming to attend those events. And then for our students who are thinking about starting up businesses, we are part of the National Science Foundation's I-Corps program. Both NJIT and Rutgers are NSF I-Corps sites, and we participate. We're linked to the New York City NYC node, and this is an opportunity for early stage entrepreneurs, students, and faculty to really do that customer discovery piece and understand, is anybody really interested in the technology that you've been spending all this time developing? Do you have the right business model in place so that, Chuck, then when you get to that point where you're saying, yes, I'm interested in looking for venture investing, you've got that other market piece figured out. And NJIT has worked with over 120 student teams. As I said, I know Stevens has had teams who've participated in the program, Rutgers, Princeton as well, so that we look at all of those pieces of activity. Rutgers, for companies that have a nexus with some kind of a Rutgers researcher, Rutgers also has an early stage fund for Rutgers researchers to again do some of that de-risking. And I suspect some of the new programs that will be coming out of the New Jersey Commission on Science, Technology, and Innovation may have some other funding available to kind of do that de-risking of that very early stage piece of things.
Yeah, I just two great questions. I've worked with a couple of areas where the students in medicine are working with the business schools to put programs together. They're really interested in getting the doctors some exposure to entrepreneurship and what that takes, because that's been a problem. What's going on in the New Jersey area?
So I'm glad you mentioned that. NJIT 4 years ago set up the New Jersey Innovation Institute to really serve as a buffer organization to help industry along key sectors get access to academic researchers and capabilities. One of our I-Labs is focused on biopharmaceutical and healthcare delivery activities. We have a large partnership with Hackensack Meridian, and so we're able to work with their clinicians, their doctors, in terms of pushing them through a program similar to I-Corps to really understand what is the business aspects of some of the problems that they are looking to see. And I'm sure the Rutgers activity with their, OWJ is going to be able to do something similar.
Are you doing anything with the high schools? There's some really interesting programs on the tech side. You have IBM that's got this thing called New Collar. We all understand what white collar is. We all understand what blue collar is. New Collar is taking a 6-year program, taking 4 years of high school, adding 2 years with an associate degree, and the kids that are coming out of that, they're offering jobs at IBM and Microsoft, $70,000 a year. Do we have anything going in New Jersey along those lines? Because that's kind of an area of interest. It's not something that we can deal with right now, but it's clearly an area of interest, particularly in some of the minority community areas. If we can get to some of those high schools and bring those kids along, we can actually give them a really much better life.
Oh, absolutely. NJIT has a very large pre-college set of programs. So if you were on our university campus during the summer, you'd see a lot of people about this height who are running around taking programs in computer science, physics, biomedical engineering, giving young people from many of these as you say, underserved communities an opportunity to get access to some of the STEM disciplines and activities. For a couple of years, we've run with support from Verizon, we've run Girls Who Code to, again, give young women an opportunity to take a look at and understand some of these types of activities. Rutgers has some similar programs, and I think Stevens as well has a lot of these pre-college initiatives. Because again, part of it, we're looking to be sure that we've got that pipeline of workers who are going to be able to go into these STEM jobs, because if you look at the data, there's not enough people to be able to fill the jobs that we're going to need to have filled in the economy going forward.
One of the things we do is we sponsor radio programs that reach millions of Americans, and we want to do this probably next year. We want to start getting some of the word out, because we don't, I've never heard a lot of the stuff. And I'm finding out about it because I'm asking questions. But I think that the American public really doesn't know. We'd like to see radio stations like in New Jersey do some of this, and we'll produce the radio stuff. We have very high quality producers that we work with, and one of the radio people is a woman 2 years out of college, and I like it because she does a great job speaking to the millennials. We've got to get to the millennials. We've got to get them excited about this. This has got to be done. Please.
Yeah, great.
Good morning, everyone. Let me see a show of hands, if I could. How many folks have been to New Jersey?
David,
Oh, all right, pretty good, pretty good. So I was going to say, if you haven't been in a while, things are changing, and I think that's the message that you're going to hear from everybody in the room. Glad I woke everybody up there a little bit. Again, my name is Kathleen Coviello. I work for the State Economic Development Authority, and really came in to this role after spending my career in venture banking. Chuck's comments about filling that valley of death are near and dear to my heart. And did it both in the private sector and now in the public sector. And I think for life science entrepreneurs, you have to look at every angle on how you fund your company. And I think there is some unique opportunities that we see in New Jersey to fund your business. And sometimes it's a direct investment, and sometimes it's something else. So a few things the state has had in play for a number of years as our tried and true value add for life science entrepreneurs includes our net operating loss program. So it's a $60 million annual pool, if you're not familiar with it. And that pool turns losses into funding. And I feel like your fairy godmother every June when we accept applications, and people never believe me when I say, are you losing money? And they timidly say, yes. And I'm like, that's great, awesome. I'm like, I can help you. I can give you money if you're losing money. So if you have a New Jersey net operating loss, or you're doing R&D in New Jersey, you can sell those losses and you can sell those R&D tax credits to profitable companies. And folks say, okay, well, how big is it? So for the last 3 years, the average award has been over $1 million. So $1 million, non-dilutive capital. You apply in June, in August whether or not you're going to be into the program. When you look at trying to raise capital from VCs, I don't know anywhere where you can turn money into cash that quickly. The diligence is pretty straightforward. You have to have intellectual property that's protected, and you have to meet certain thresholds for employees in the state, and you have to have account prepared financial statements. It doesn't have to be an audit, because we know for the young companies, you don't want to spend cash on that. So that has been a tremendous program. You can incur losses up to almost $150 million and participate in that program for a $15 million cap per company. So we have a company this year that actually is going to get $13 million of an award, and they give up no equity for that. And what we've seen is that's quite an attractive tool to other investors as well, because they know they can't fund that whole valley of death, or can't fund you to your next clinical trial perhaps, or want to wait until you have that phase 1 data results before they'll come in. So going to investors and saying, I'm in the state of New Jersey, I meet the program requirements, and oh, by the way, I have a funding source to get me there, kind of perks the ears up of interested in investors. So certainly something that's been around the state. The new governor, Governor Murphy, thrilled about that program, and we expect it to continue for quite some time, hopefully. The next kind of newer program that we have for funding folks and de-risking, as Chuck said, kind of de-risking that investment is really important, is an investor tax credit program. So $25 million annual pool, a 10% tax credit. But what's interesting about the New Jersey tax credit is it's a cap of $500,000 per investor per financing round. So what we've seen is investors come in and do the seed round, put $5 million in, get $500,000 back. Do the Series A, Series B, so on and so on. And if you have a club deal with several investors, each investor can take advantage of that. So we now have companies that are out fundraising and have the investor tax credit program in their deck. So they're going to investors and saying, I can give you a 10% ROI on your money within 6 months. I don't know where else investors can get that. And if you, especially in biotech, right? And if you are an out-of-state investor, don't worry, you can still participate in the program because New Jersey sends you a check. So you have to file your New Jersey taxes. If you have no offsetting liability in the state, in the country, we will send a check. So about 51% of the investors this year in the program are out-of-state investors, and a good percentage of those are out-of-country investors. So when we see companies in our biotech incubators, a lot of them are successfully fundraising from overseas. We're seeing a lot of Chinese money come into these young companies, and we will send them a check. And the surprise from these investors is quite interesting. We've seen quite a few of them endorse those checks and put them right back to work in the companies, which is the win-win that we want. So we're incentivizing investors to look hard at New Jersey companies. So again, another kind of, not a check into the company, but helping get the money around the table that you need. The incubator network that Debbie talked about and Judith talked about as well is growing in the state. And we hear that from folks all the time, trying to find space, it's too expensive, I can't find the small space. Under our new governor, Governor Murphy, we've even launched a program to provide free rent for you to go into New Jersey's incubators. So we'll provide anywhere from 1 to 9 months of free rent, and it's being matched by the incubator manager. It could be an incubator, it could be a collaborative workspace, it could be an accelerator, any of those work. But we want you to spend your money on research and not on monthly rent payments. And so this is a tool to get you into those locations. We also think it's important to get you out of your home. And we see a lot, particularly in the life science, a lot of virtual businesses. And we were talking out in the hallway about it's so important to have that marriage of science and operations and business management. And sometimes it's hard to do that when you're alone. So we think this is a good way to get you out and working and collaborating with others. And just a few other things that I'll mention, because I want to leave time for my fellow panelists, is the Evergreen Fund. So Governor Murphy announced earlier this year as part of his economic development plan that the state is launching a $500 million Evergreen Fund. And that Evergreen piece that Chuck talked about is so important. And it again brings to the heart of this funding collaboration. So it's being raised through the issuance of tax credits that are going to be auctioned off to our corporate partners in the state. And not only do they have to say what they'll pay for that tax credit, but they have to say what they're going to bring to our innovation economy. So I've seen way too many companies die on the vine trying to sell into large corporates in the state of New Jersey. And so if you tell me I have to get into Hackensack Meridian Health, or I have to get into RWJ Barnabas, you're not going to the government relations person. When these companies buy this tax credit, they're making a pledge and a commitment. Actually, it's going to be a contract to open their doors to these companies. And it's going to be a little bit of a bake-off to see who's going to offer the best opportunities for these companies. So we're really excited about that. It'll be managed by professional managers. So the managers will be able to pull down from this pool of capital that the state of New Jersey has created. And what we have heard thus far is the VCs are saying, listen, you're increasing my pool of capital, you're letting me manage it, it'll go onto their balance sheet, generate fees, earn carry on it. I'm bringing companies to New Jersey. There's no reason not for me not to tap into this pool when I know there's opportunities for more capital for me to manage. So we think it meets the needs of both the entrepreneurs and the investors and kind of building the ecosystem. And then Debbie also mentioned the central location. So that's kind of our challenge in the state of New Jersey. Things are diversified. We have a lot of great incubators and a lot of great real estate coming into play in the state, with a lot of pharma kind of transitioning. It's created a lot of opportunity on those campuses as well that we're seeing the biotechs really take a hold of. But there will be a hub located in the central part of New Jersey. We're starting to sign up companies as we speak. We anticipate that there will be some foreign universities anchored in that campus as well, and it's right on Rutgers campus and a train line as well. And then I would close as well, just to try and find what the assets are. Judith mentioned that. We launched under Governor Murphy in August a database called Research with New Jersey. I was meeting with a company from Boston on Friday afternoon, and they said to me, well, how do I find out, who's studying what in my space? And I said, here's the database. And we looked up kind of the periodicals that have been published by professors at each of the doctoral universities in their space. They're like, this is free? I'm like, yes, it's free, even if you're not in state. But you can know what's going on, and then we have liaisons into the universities. We don't want you having to kind of call each individual professor, but those liaisons will help us get in touch with who's doing what research. So, that's just the icing on the cake. There's a lot more to come, but you can see we're trying to find different and creative ways to tap into non-dilutive resources in the very kind of 0 to 3 stage that you talked about, to incentivize folks to invest in these companies and to know what's going on in the state and with these companies.
Quick question. In one state that we're working with, new jobs come in at $82,000 for life science compared with the national, or the average in the state of $46,000, so almost twice as much. And it brings in, I think it's 4.8, I don't know how you bring in exactly 4.8 jobs, but essentially these are non-life science jobs. So it's a huge engine.
Yes.
You're in the economic development. Do you have any numbers for New Jersey or anything that you would, if you don't have the exact numbers, do you have a ballpark?
Yeah, it's interesting, Chuck. I don't know the exact stats off the top of my head, but again, anecdotally, 3 companies I met with in the last 3 weeks that are in the biotech space that are talking about hiring. Average salaries for them have ranged from $110,000 to $125,000.
That really is amazing. And I think there's a future, and I hope that we can get some of the young people going, because I think that that's got to be a really good opportunity if we can train the next generation at a very early stage in high school and college. So I hope that works. Jen, what's going on in New York? No pressure here.
I know. So wait, Doug and I should have been at the front end of the panel. We've never heard real estate is too expensive in New York. And we've never heard that we don't have enough medical centers. So, no, we definitely have that. And we're getting to 10 minutes. I'm going to talk fast, even though I'm originally from the South. New York is, we have an amazing ecosystem developing. And it's interesting that I've only been at New York Bio, which, like Debbie's organization, is a membership organization. And we represent companies, bioscience companies with a presence in New York, the state at large, both the city and upstate. And we represent them in the government affairs space. We serve as a convener, and we help companies network to find the right connections within the industry as they grow and find funding. And one thing that's been very interesting to me in the 6 months that I've been at New York Bio is the number of incubators, right? The number of early stage. As I was sitting here thinking, I think I've counted about 10 in the downstate area, in the city, Long Island, Westchester. And so we have a ton of growth. And now the conversation, J-Labs, which is one of the sponsors, clearly is open. We have BioLabs opening this month. That's a partnership with NYU Langone. One of the interesting things particularly about the city, we have, I think, $2.4 billion a year in National Institutes of Health, so NIH funding flows into the state. And obviously the vast majority of that goes to our research institutions. We are number 2 in the country on academic R&D spending at around $4 billion a year. If you think of just the research institutions that are located in the city, we have their TDI, which is a partnership to spin out early stage development between Rockefeller, Memorial Sloan Kettering, and Weill Cornell is getting up and running and off the ground. And we have even upstate between Buffalo and the University of Rochester Medical Center, and I'm totally trying to blank on my third one. But there are all kinds of collaborative efforts that are specifically aimed at focusing on incubators and these early stage companies. And I honestly think that we are reaching some sort of critical mass with the early stage offerings that we have for companies. And I think the next discussion that we're going to have, particularly in the city, is what's next. And clearly New Jersey would welcome the companies as they grow and get bigger, and it's going to be up to us in New York to figure out what space looks like for Step Up, for the next stage companies as they build out. We have an interesting facility at the Brooklyn Army Terminal. It's called BioBat, and it has larger space. They can do manufacturing there. So there are all kinds of pieces of this puzzle. And one other piece that's interesting in New York is the number of disease foundations or patient groups that we have represented here in the city, in combination with certainly the capital markets. You don't get any more capital market intense than you do in New York. And so we are looking for ways to partner to find connections between all of those disparate groups: companies, research institutions, patient groups, as well as capital. And that's not a big job at all. So I welcome my part as New York Bio, and then I'm going to turn it over to Doug Thiede from the City Economic Development to introduce what they're doing.
Sure. Thanks, Jennifer, for the nice intro, and Chuck, thanks for having me on the panel. So given the time context, I'm happy to take any questions, but I lead both the city's efforts around healthcare and life sciences, including the mayor's $500 million initiative to boost life science infrastructure and commercial R&D here in the city. It was announced about a day from when the governor also announced a $620 million investment throughout the state. I bring that up in the sense of, I think it's a really exciting time to be in the tri-state area, given the amount of capital that the governor has allocated, the mayor has allocated towards this, and what our colleagues here have mentioned about New Jersey. As far as the city initiative, I'll just touch on a few things. So Jennifer alluded to some of the space needs. So for a long time, the fundamental idea in New York City was that we have a great density of academic medical institutions that produce great biomedical research. Jennifer commented on some of the NIH dollars that flow in New York State. So we have that density, but what hasn't happened is those haven't been companies or products that have come out of those institutions, and if they have, they've gone elsewhere. Maybe New Jersey, maybe Boston, maybe the West Coast. And so the reason we bring up incubators is that is a place for those companies to continue to grow. And as Jennifer alluded to, we're spending a lot of time trying to figure out where companies will go next. And I think you'll see different clusters throughout New York City to solve for those type of instances. If you go from 5 to 10 people, maybe raise your Series A, you're thinking about where are our options. There are some exciting long-term options. Alexandria Center for Life Sciences just announced their third tower, which will be opening. That's a partnership where EDC worked with them on city-owned land. That'll be over 500,000 square feet, opening right across from the current 2 towers in about 5 years. So we're trying to really figure this out as far as some near-term answers to solve for those longer-term strategic plays on the space issues. The one thing I do want to touch on, Chuck, you struck a chord on some things that I think are very important to the city. One, jobs. So this initiative is designed to get 16,000 jobs within commercial R&D that's independent of the academic centers. But also the early stage talent. And one of the initiatives we have launched is our summer internship program, where this past summer, 82 students across 41 different companies got a mix of both business and lab experience with companies. And we really feel that that's an important investment to be making now, not just for those statistics, but we really feel that those can be some of the future leaders of companies throughout the growth. So as we're trying to parallel with some of the space-based initiatives, we also want to be looking at the well.
It's very interesting to me that all around the globe, we're seeing this activity pick up, and there just seems to be a lot of enthusiasm. So I think it's really exciting, and really it's a question of kind of how do you capture it. Doug, can you comment a little bit on, I know the Partnership Fund for New York did a study. I've talked to Maria Gotch about it, and they now have apparently put $10 million in, I think alongside the state's $5 million to a fund that will be somewhat comparable, I think, to what they're doing in New Jersey, but can you give us a high level?
Yeah, high level, I'll speak to it. So what you're alluding to is the state announced earlier this year a partnership with IndieBio and SOSV Ventures, that the Partnership for New York will be running that fund. The idea is IndieBio is an accelerator that was in San Francisco. They want an open procurement process with the state and will be opening in New York City next year. As part of that fund, a component is companies will apply, go through it, they'll have a 4-month accelerator program where they'll get $250,000 from that fund. And the idea is that's a staging ground somewhat for Valley of Death, but also general seed funding that the Partnership Fund for New York and the state might be doing some matching funds going from there. So as we're seeing companies come out of some of those incubators or the academic centers, we're really excited that that's happening in New York City. They certainly had other options, but that's something that, while we're not directly involved, I think we're very supportive of the state's effort and the Partnership in New York.
Yeah, I was actually in Sydney, Australia when I met SOSV, the guy from New York City. In Sydney, and I were both from New York City in Sydney, Australia. But I think that shows that this is a global effort.
I'll comment on one other thing that you mentioned. So the Partnership for New York a few years ago did a study that mentioned New York City and the state has the great NIH funding that Jennifer mentioned, but the venture capital doesn't follow.
Right.
At the time of the study, it was 6 cents on the dollar, whereas Boston
Right.
and San Francisco is north of $1. I think what you'll see is creative initiatives like IndieBio and SOSV, VC funding that's starting to happen at a much more accelerated and deliberate scale throughout New York City. We're changing that trend over time. There's still a long way to go. We don't pretend to be at the same level of the West Coast or Boston, but I think the focus is more of, in this metro region, how do we take these creative ingredients and make the best of the scientific expertise that's here and the entrepreneurial hustle that's in New York City and throughout New Jersey.
And if I could just build on that. So, when you kicked off the panel, you talked about there's competition obviously around the world, but may I suggest that what's going on here in both of our states is just extraordinary, and you are not the competition, right? If we talk about our story as a collective story, it is extraordinary, I think second to none. So.
And I do think that particularly young entrepreneurs who have put down roots, whether it's in this case, or in the metro area, Northern New Jersey, or in the city, or even Long Island, they want to stay. And so they don't want the VC to tell them they've got to pick up and move to Silicon Valley or even to Boston. And so they really want to stay. And so this is part of helping them to do that.
Yeah, and that's one of the things that I'm really excited about. I don't want as a family office, and working with we have a family office network of 250 family offices that we've been meeting. They meet about quarterly in 17 cities, in 6 countries, in 3 continents, and I think that there's a lot of interest in getting involved. And we haven't done much really with New York, although we're having our second gathering of family offices today here. But I think that there's a real opportunity to bring some of the funding that has really not been brought to this whole area. And one of the, I'll put a plug in for the next panel, which I'm moderating, and that is that the venture capitalists have a model that they want to do therapeutics, maybe one of the panelists can comment on it, where they would rather have a therapeutic that's out there where they put in $50 million. If they do it 10 times, it's a $500 million fund. And if they can keep it out for 10 to 15 years, they get the management fee on that. And if they get a big hit, they get 20% of the net above the $500 million. That's a good model for them. Family offices and angels want something very different. And I think, Doug, we talked a little bit about the traumatic brain, or no, there was another guy talking about traumatic brain injury. That would be something that would be much more interest for the family office, because we probably can be done for $15 million. And families and angels would much rather have a big percentage of something that they don't have to be feeding lots of capital into. Who would like to, on the panel, to comment on that? But that's one of the things that we're seeing. And so the next panel is going to be on family offices and angels working more closely together, which is one of the things that we're actually going to be at the Angel Capital Association next week in Irvine, or no, it's later this week, talking with them, because they really want to work much more closely with the family office. Family offices are the group that has not been pulled together on this, and that's what we are pulling together around the globe. So who would like to comment on that?
Well, just based on experience, I think you're probably the best person to comment on that.
I'd like your opinion.
No, but what I would say is we have made a calculated choice in the city to focus more on the real estate equation and talent, knowing that similar to seed stage investing in VC, that will take a long time to mature. So I'm not ignoring that. We have funds available and funds that will be deployed to help solve that equation. And I would encourage having a discussion about that, both from the family office perspective, as well as Jennifer mentioned the foundations, right? They're changing their model as well as far as R&D investment. And so I think we would explore both of those in more of a partnership form. We may not be the lead investor just based on our capabilities, but we're certainly interested in supporting it in different ways that we can. And I think you'll see that in the months and years.
Good. By the way, NIH is supporting the Angel Capital Association. They said they're going to support us too. So that's kind of a change. I want to get one or two questions if we could. Let's do two questions. You have a question there?
Well, rather quickly, Kathy, you mentioned that you need an IP, at least for your anchor for the investment, but just talking to an Israeli early stage company last week, and we're talking about the cost of doing the patent registration, et cetera. Are you referring to the fact they could have a provisional patent? Are you being more specific about that?
Provisional is fine. For the net operating loss program, I think that's what you're referencing, the $60 million annual program. So just a provisional is fine. We just want to make sure that you've gone through the analysis and have started the filing process.
Okay. Is there another question? There's a question.
So I know that New Jersey has like a hub or a portal you can access to different research programs, and I wonder if New York can help to introduce to like Cornell or Columbia or some patent or the research information.
So I would say two options that you have. So lifesci.nyc is a website that it may not navigate you directly there, but I would encourage you, whether it's the city, the state, New York Bio, I think that's part of our obligation is to help connect and or convene and navigate folks to the right spot. So we can certainly find information there. I'm also happy to try and facilitate any of those connections with tech transfer offices or different groups.
What's the website again?
Lifesci, LIFESCI.NYC.
Okay, thank you.
We're out of time now, but I'm sure the panelists will be glad to talk to you further just outside. But I learned a lot. I want to really thank the panelists for a great job.